Hi, I'm Donna Dowell, board-certified family nurse practitioner and part of a growing number of healthcare professionals in New Mexico in support of the New Mexico Health Security Plan, a plan that will ensure comprehensive, quality healthcare coverage for New Mexicans. Healthcare under our current system is challenging for many. This short video is part of a series that features the personal healthcare stories of real New Mexicans, stories you will recognize as all too common.
From Los Alamos. Was a family physician for 39 years, working all of that time in small towns, the last 19 in Los Alamos. I retired a couple of years ago and had strong opinions about what I was seeing happening over the span of my career. I felt like I was watching insurance companies could just get steadily more brazen in what they were doing to control spending, but also to manage their profits. And they were stepping in more and more in terms of what patients and providers and hospitals and pharmacies could do and couldn't do, all the while saying that they aren't practicing medicine, they're just saying what they'll pay for. But their decisions have enormous effects on the care of patients. I'm going to give you a case story that sort of illustrates that. I had a patient who was about 60. She had worked as a caseworker at a dialysis unit for many years. She was very savvy about how the health system works. After she retired, her health insurance was through her husband's employment. That was through United Healthcare. She started developing pain in her left upper abdomen near her ribs. It was an unusual, persisting sort of pain, and on a CT scan what we found was that various different specialists got involved in her care. It was important, we felt like, to check and see could this pain actually be coming from her colon, which is right in the same area. But the GI doctor said that it's just too risky to push a colonoscope through that area. He didn't want to run the risk of rupturing this aneurysm, and so he felt that the best bet was to do what's called CT colonography, a special type of CT scan to look at the colon. And her insurance company said they weren't going to pay for that. It's a bit of an unusual test. Had an aneurysm, and it was an unusual one, going in an artery going to her spleen. And I explained to them why in this case it made a lot more sense than doing a colonoscopy. It was going to really be necessary, and they weren't buying that. So the patient ended up paying for the CT colonography herself, and it cost her over $1,500 out of her own pocket. Fortunately, the scan turned out well, but she kept having this pain, and eventually her vascular surgeon in Albuquerque said he was really concerned that this was indicating this aneurysm might rupture, and if it did, she could have huge amounts of internal bleeding and die. So he recommended that this aneurysm be repaired, but it turned out that the hospital where he does most of his surgery is not in the United network. Surgery would have to be done in a different hospital, and they had a 3-week waiting list. So she was on this waiting list having increasing pain, knowing that if this aneurysm ruptured, she might die. And eventually one night the pain got bad enough that she went to an emergency room and ended up having emergency surgery to have this aneurysm repaired. Fortunately, the surgery went well, but she really had no choice about going through this waiting period unless she wanted to spend $40,000, $50,000 for her to have this surgery done in an out-of-network hospital. So at the end of all of that, she was just absolutely frustrated and depressed and angry that one of the largest health insurance companies in America had treated her this way around something as life-threatening as an abdominal aneurysm.
Dr. Taylor, a provider perspective. Our current healthcare system puts patients at risk for harm and even death. The insurance company denied 2 doctors' recommendations for a CT colonography. a test that would have virtually eliminated the risk of perforating the patient's aneurysm, a ballooning in the wall of a blood vessel close to the colon. A perforation or rupture of an aneurysm causes internal bleeding, often leading to death. The GI specialist and Dr. Taylor were both of the opinion that a routine colonoscopy, which is covered by insurance, was too risky for this patient. Both doctors were of the opinion that the patient's pain was an indication of an impending rupture. Scheduling the patient for surgery, either within the patient's insurance network or providing coverage for an out-of-network provider and hospital, would have been the only ethical and safe option given the emergent nature of the patient's condition. Insurance networks restrict access to health care. Under the current system, patients are restricted to providers in their plan's network. Every time a patient changes insurance plans, their doctors change too. Patients often lose the providers who know them best, severing continuity of care. With the Health Security Plan, patients are free to choose any doctor or hospital, even across state lines. There are no networks, and providers are free to include all patients in their practice panels. The New Mexico Health Security Plan ensures comprehensive, quality healthcare coverage for New Mexicans, regardless of income, health status, or employment, provides choice of providers and hospitals, coverage extending across state lines without network restrictions. How can you help? Become informed at newmexicohealthsecurity.org. Sign up for campaign alerts or donate to the campaign. Contact your New Mexico state representatives at nmlegis.gov. That's nmlegis.gov. Tell them to vote for the New Mexico Health Security Plan. Tell your own healthcare story at newmexicohealthstories.com. Contact us at nmhealthstories@gmail.com. Spread the word. Forward this to your New Mexico family, friends, colleagues, and neighbors. And thank you so very much.